You are lying on a table. A mask goes over your face. A needle enters your arm. Someone counts backward from 10. And then nothing. Not sleep, not dreams, not darkness. Nothing. No sense of time passing. No awareness of existing. No you. And then you wake up. 2 hours have passed. You experienced none of it. Where did you go? What anesthesia actually does. Most people think general anesthesia puts you to sleep. It does not. Sleep and anesthesia look similar from the outside, but inside the brain, they are completely different states. During sleep, your brain is extraordinarily active. It consolidates memories. It processes emotions. It runs maintenance cycles. It dreams. You are still there, just offline from the outside world. During general anesthesia, your brain does something far stranger. It stops producing consciousness entirely. The you that reads these words, the you that has opinions and memories and fears, the continuous thread of experience you call your life. Gone temporarily, completely. The hard problem. Here is what makes anesthesia so disturbing to neuroscientists. We do not fully understand how consciousness is produced in the first place. We know which brain regions are involved. We know which neural networks correlate with awareness. But the precise mechanism, why physical processes in neurons produce the subjective experience of being you, remains one of the greatest unsolved problems in science. It is called the hard problem of consciousness. And anesthesia makes it harder. Because if we do not know how consciousness is created, we also do not know exactly what anesthesia is switching off, or where you go when it does. Here is what we can measure. Under general anesthesia, the brain does not go quiet. It stays electrically active. Neurons keep firing. Blood keeps flowing. The machinery keeps running. But something changes in how the parts communicate. Normally, your brain regions talk to each other constantly, a dense web of coordinated electrical signals producing the integrated experience of being conscious. Under anesthesia, that coordination collapses. The brain regions become isolated, each one firing locally, but no longer integrating information globally. Like an orchestra where every musician keeps playing, but nobody is listening to each other. The music stops making sense. Consciousness requires integration. When integration collapses, you disappear. The disturbing part. Here is what no anesthesiologist will tell you before surgery. In approximately 1 in 1,000 cases, patients are aware during surgery. Not in pain. The anesthetic that blocks pain works separately from the one that blocks consciousness, but aware, unable to move, unable to signal, experiencing everything. This is called anesthesia awareness, and it happens more often than medicine is comfortable admitting. But the deeper disturbing truth is the opposite question. Not what happens when anesthesia fails, but what happens when it works perfectly. For 2 hours you did not exist. There was no experience, no continuity, no you. If consciousness is what makes you you, then you briefly cease to exist on that table. And something that had your memories and your face woke up afterward. Was that you? Or a continuation so seamless it is indistinguishable from you? Science cannot answer this yet. But the question gets harder the longer you think about it.